Hey everybody. So in this video in our self-care rehab series, we're going to be handling IT band issues and general back and hip stuff. And by back, I mostly mean low back, but it may be a little bit higher depending on what your issue is. So our initial disclaimers, as usual, go look at the boilerplate video link in the description. That one's important. Talks about who I am, what I do, and a little bit more of how this stuff works, so I don't have to explain that in every video other than just this brief disclaimer, which is that this is homework that will take care of a lot of the pains and dysfunctions I see coming into my office between IT band, general hip stuff, and back stuff, but you're not my patient. I'm not able to look at your situation. This might not be effective for you, or it may be inappropriate for you. I can't say. This is just something for you to try out, especially if you're on a long trail and just need something to have you get through it until you can get it properly looked at. As always, especially if you have some particular medical condition or especially circulatory problems, or you suspect or know you have an injury, don't do this stuff without someone say so that it is okay, and clear of the physician type of practitioner, whoever's appropriate given whatever it is you have going on. So that stuff aside, like I said, we're going to talk about IT band issues and some general hip, low back, maybe mid-back stuff. We luckily have a body model to be able to show you what we want you to work on, because it would be a little bit difficult showing you on myself. And we're going to put in some anatomical pictures into the video, so I'm going to show you on our model over there, as well as show an image of exactly what I'm talking about without, say, skin and clothes in the way, so that you can get as accurate on these spots as possible. So to continue to be a little bit repetitive, with a good amount of the hip and back stuff, we are still wanting you to do the foot ankle videos. That's going to have a big impact on how the hip operates. And again, similarly, some of the head and neck stuff will likely be a big part of this too. When it comes to local, just overall hip back stuff, as well as the IT band issues, there's kind of two main structures I want to work on here for most people, or kind of three, but we'll demonstrate two and we'll talk about the third one. The first one, just because the lines are still apparent, because I just tried to leave some on her low back so you could see them decently. So we call the interspinous ligaments. We'll again pull up an anatomy picture to show you what I'm talking about in a minute without the little skin and living person in the way. That you have these spiny bits of the spine that poke out as we go through, and in between there are soft ligaments, technically over the spiny bits too, but we would have you just with a fingertip, and it just depends on you how well that's going to fit in. Some people can do it with a thumb, some with a finger, but just generally back and forth slowly between the very end of the lumbar spine, so where the actual vertebrae stop and turn into that weird crustacean shaped thing that we call the sacrum, and up just a bit above where the ribs start. And so I would go into a segment, slowly rub back and forth, maybe a bit from one side, a bit from the other, and take a good 10 to 20 seconds per segment. Any that you find that are especially tender, be gentle, but spend a little bit more time with, because it just means that they are implicated, let's say. And so we look and see the ribs are ending about here, and I'd want to go up a segment or two above that as well if you can reach it, or have a friend help you with it. Just again, be slow and non-punitive with that actual work. If I can reach it, I actually kind of like pinching the ligament and kind of going back and forth. The second structure is you're going to find that actual shelf of the hip, the top of the hips, where if you were to sink into the soft part of your back and just go down, you're going to run into the iliac crest, if you're dying to know. Who isn't dying to learn Latin? And you're going to then go and meet the spine. And from this spot, that vertex between the two, you have the hip bone here, the sacrum here, and you have this kind of soft channel that goes down into the hips that we call the SI joint, the sacroiliac joint, and the sacroiliac ligaments. Again, more Latin. Very useful on trail. And so with a thumb on myself or with a patient just fingertips, I'm just going to gently kind of rock back and forth on that, nice and slow. And from that spot between the top of the hips and the spine, I'm generally going to go down a few inches, say on her about here. So we have at least a good 3 inches, maybe 4, and that's the case for most people. And we'd have you gently work that on both sides. Lastly, well, it's usually side specific, it's not going to give you too much harm, where I would have you gently, very, very, very gently, work on the outside of both sides of your tailbone. So actually working your way down to the coccyx. Usually the right side is what needs it, to be honest, but just as long as it's very, very gentle, you could work on both sides. And I will toss in, this is going to be the general releases for almost everything we do that's going to be hip and back, but specifically if you're having IT band discomfort, I would still do all of this, but especially those 2 SI ligaments, and we'll give you a specific piece of movement homework to do afterwards for the IT band stuff instead of just rolling it and, well, making it worse. So when it comes to the IT band exercise that's going to go with the releases, it's really pretty straightforward and really pretty simple. If you don't have good balance, and mostly folk back home, not so much on the trail, you might want to hold on to something. Otherwise, it's simply going to be not a forward leg raise, not a side, but you're going to kind of rotate the leg in a little bit, and it's going to be diagonal, mostly forward, maybe 15-20 degrees out. And as with everything else, first fatigue and you stop. That's it. So when it comes to the back and hip exercises, we're gonna go a bit full spectrum in a fashion. Instead of just doing one exercise like we did for the IT band, I'm gonna give a few options just to make sure that we hit all of the main players that are likely to cause issues in that region. Again, as always, it could be something else, but this kind of touches on most of it. So the first is a simple bird dog. However, there is a place for this to be done wrong, as well as most of you probably don't know what that is, especially because there's like 80 million names for every exercise and movement. But what you're going to do is you're just going to be on all fours. Try to keep your back and hips neutral, and one at a time, you'll extend a leg out in line with your body, and once you have that balanced well, opposite arm out, head will be in line, but just so I can look at the camera and make the audio sound a bit better, I'm talking towards the camera, but it's going to be held for just a good stomach breath, and then slowly switch sides. If your balance is good, I'd have you lift at the same time with as minimal delay as possible, but otherwise it's a slow full hip extension, arm up, deep breath, switch sides, going slow the whole way, and as always, if you get fatigue, you stop, the first fatigue. But I will say a lot of people will lift up their calf instead of the actual femur, the upper leg, or they'll rotate their torso, or it's barely up at all, and so it takes a little bit of kind of self-feedback and figure out where you're at. If for some reason, say for folks at home, and your knees won't let you do this, or some other discomfort, what you can do is just lean over elbows or hands on a chair, on the back of a couch, on a table, something like that, and basically do the same motion with just a leg back behind you, one at a time, which bit by bit you get a tour of my office. So it would just be that same thing. I don't want that curled leg, I want the leg as straight behind as possible. First fatigue, stop. Then for our second exercise, this one's pretty straightforward as well. This really does require someone to lay face up, which means if someone has a difficulty with, say, getting up and down off the ground, using a couch or preferably a bed would work just fine for this. And for the hiking community, find a spot that's remotely flat, that's not a ridge walk. You're good. Simply going to be laying face up, and letting your legs slowly go side to side. So I know that's going to seem like, oh, well, that's doing nothing. I could do that forever. It's not a strengthening exercise. None of them really are, even though it may have that mild effect, especially if someone's had some mild degree of atrophy or misuse for a long time. Really, it's all about going through the homework process to show the brain you can in fact use it again. It's almost more like replugging in a wire that's come out more than actually strengthening it, because usually strengthening is, it's not that it's not important, but that's not usually the problem. It's just that you can't access that muscle, and that's what these connect you to. So even though it seems like basically nothing, it will get the job done for those who need it anyway. So we have one last exercise, and I'm just going to keep this weird camera angle more or less. This is called a vertical bird dog. So, same kind of notion as a bird dog, just using the other side. Again, if you have balance problems, you can hold on to something and just do the leg portion. That's going to be a leg raise up to around parallel with the ground. And an opposite arm, take a deep breath at the top, slowly switch side to side. Again, if you have a balance problem, you could hold on to a counter and just do the leg lifts. This gives us a lot more, but it's just extra more than it is completely necessary just to deal with it in the first place. And before we move on to wrap up, I just want to add that the bird dog might also directly help the IT band stuff, but like I've probably already said repetitively, especially because I'm doing these videos in different levels, chunks and putting them together, who knows what I've repeated? Well, you do. I may have forgotten. But when it comes to IT band stuff, you're going to want to do a lot of the hip stuff anyway, but that bird dog will also likely directly assist it as well. So make sure if you have IT band stuff just to do the whole hip low back complex anyway. So as it is, that's our full IT band hip low back video. We have others sitting around that will have already been published, will come out afterwards around the same time, so take a look. Again, I'm going to be on trail in about 2 months from shooting this video, so I have a short period of time to really be able to answer questions before I'm occupied. But if you have them, shoot them over and I will do what I can. So I'll see you in the next video. Like, subscribe, and we'll have more out there for you soon.